Okay, this video is called New Atherosclerosis Vocabulary. Okay, so everybody knows CAD. CAD means coronary artery disease. Okay, and that typically refers to the epicardial coronary arteries, the big ones on the outside of the heart. You can get microvascular angina, microvascular atherosclerosis in the smaller arteries, so-called syndrome X. Okay, microvascular angina. Okay, but now let's talk about the legs. Typically in the past, lower extremity atherosclerosis was called PVD, peripheral vascular disease, but more and more people are calling it PAD. And I kind of like that name, PAD, for peripheral arterial disease, which is atherosclerosis of the legs. And you can include the iliac arteries in that, the ones that are in the pelvis, but they've already branched from the aorta to right and left common iliac artery. And they get atherosclerosis that can contribute to symptoms in the leg, like claudication, meaning pain with walking. Okay, now here's a new big one, brain arterial disease. Now, in the past, you'd hear the term MID, multi-infarct dementia, but I almost never see that, which would be like a bunch of convexity infarcts. And it can include other infarcts, lacunar infarcts, etc., watershed infarcts, but that ends up not really being a useful term. I literally never use it. VCI, I'll occasionally see that in requests from neurologists, vascular cognitive impairment. And that's a decent term. That sometimes gets used, okay? Most of the other terms are just too long-winded. Small vessel cerebrovascular atherosclerotic ischemic disease, okay? Yeah, that's a mouthful, okay? And so I'm thinking we could call it BAD, brain arterial disease. Now, there's a little bit of negative connotation with the word bad, but that's what it is, brain arterial disease. Okay, and a lot of it's, things like overtreated hypertension with result in hypotension and that causing hypoperfusion of the brain. Okay, here's another one. Now, what do you use for the word Johnson? First of all, I want to say don't even think of calling it dad, okay? That would be a bad choice of descriptive phrases. We can just use the phrase JAD for Johnson arterial disease. Okay, what about other organ systems? Well, for the spine, we can call it SAD, spine arterial disease. Yes, I realize it might get confused with the standard American diet, but, in the context of talking about anatomical disease, the spine, we can know that SAD equals spine arterial disease. Okay, there's a mechanism of spine degenerative disease, like my theory of, Peter Rogers' theory of spinal ischemia as the most common cause of back pain. I've gone over that in separate lectures. Okay, VAD, vision arterial disease, because if you call it eye arterial disease, that doesn't work. If you call it O for ocular arterial disease, that doesn't work. But VAD works, vision arterial disease. HAD, hearing arterial disease, because this is a lot of what people go blind. Almost all of the eye diseases of aging are vascular. C-dog is a mnemonic, C-DAHG, cataract, then diabetes, age-related macular degeneration, hypertension, glaucoma. Okay, all that stuff is related to arterial disease. Glaucoma, especially with hypertension. Cataracts, especially with things like, dairy products. Okay, HAD for hearing arterial disease. We didn't want to go with the E, so hearing arterial disease works. Lots of people go deaf from that. Some ischemia, lack of blood flow to the hearing apparatus, the nerve or parts of the brain, etc. Okay, and chronic trauma, from working around loud noises of some sort. Useful old stuff that most people don't know about while we're in the context of atherosclerosis, because I've asked hundreds of doctors, what's a zeta potential? And they never know, even the so-called smartest ones, they don't know this. All red blood cells have a zeta potential, meaning a negative charge on their outer surface due to their glycocalyx, okay? The heparin sulfates. The sulfates are negatively charged. The sialic acids are negatively charged. The cholesterol sulfates are negative charged. Okay, and then bridging molecules are positively charged molecules big enough to stick them together, like LDL cholesterol, chylomicrons, triglyceride, uric acid, and fibrinogen. They'll stick them together into a rouleau formation or blood sludge, you might call it. Atherosclerosis is a blood clot. 99.9% of doctors don't know that, but you need to know that to make sense out of atherosclerosis. And it's like an organizing hematoma in the sense that the immune system comes into the atherosclerosis blood clot and tries to reabsorb it, and also brings in its fibroblasts and other tissues, puts in fibrous tissue, scar tissue. Okay. Amyloid clots, that's a distortion of the secondary structure of the fibrinogen, the blood clotting protein, from alpha helix secondary protein structure, which is like a cylinder, a slinky, to become flat like a deck of playing cards. That's beta pleated sheet secondary protein structure, and that causes it to stick together with itself and precipitate, which means clot, and that's way more common than is widely recognized, and it's way more important than is widely recognized. It happens due to leaky gut because bacterial toxins get into the blood, LPS from gram-negatives, lipopolysaccharide, LTA, lipoteichoic acid from gram-positives. It also happens due to iron overload, which is common in Western men after the age of 20 when they're done growing, and in Western women when they're done menstruating, let's say around 55 to 60 and older. And that also will ferrous redox cycle and cause fibrinogen to change its shape to beta-pleated sheet and be prone to clotting. And infections can do that as well, like viral infections. So what I'm saying is awareness of these things helps, because I think this is one of the part of the mystery of why so many people are getting AFib, and it contributes to dementia and everything else as well. So anyways, hope that was helpful. And why did I make this video? Because I thought it was kind of funny. I was joking around with some friends about what to call arterial disease. We thought it was funny to call brain arterial disease bad, and they thought it was funny when I said Johnson arterial disease should not be called DAD. So that's what led to the video. Hope you found it helpful.